Hello, Mrs. Digby. How can I help you?
Doctor, I've got a very painful rash. I'm a bit worried about it because I've never had anything like it before.
Can you tell me a bit more about the rash? Where is it exactly?
It's a line of blisters on the right side of my tummy. It doesn't seem to be anywhere else.
So, the blisters are not on the other side of your body?
No, just the right side.
Could you tell me what the rash is like?
It started as a red rash, then I got the blisters. They are horrible. Some of them have crusted over.
You mentioned that the rash is painful. What does the pain feel like?
It sort of burns. It's really sensitive to the touch as well. My daughter said I should come and see you. Especially because I'm getting on in years now.
It was a good idea that your daughter suggested that you have the rash checked out. The type of rash you have and the fact it is only on one side of your body suggests you have shingles.
Oh, is it? A friend of mine had shingles, quite a while ago. I can't remember much about it though.
As you may already know, the medical term for shingles is herpes zoster. Shingles is caused by the varicella zoster virus, the same virus that causes chickenpox. After a person has had chickenpox, the virus lies inactive in their nerve tissue near the spinal cord and brain. It may not be until years later that the virus returns as shingles.
Oh dear. My granddaughter had chickenpox a few months ago. Did I get shingles from her?
No, don't be concerned about that. You can't get shingles from someone with shingles or chickenpox, so she won't have passed it on to you.
That's good to know. What should I do now?
I'll talk about some self-care measures first. Taking paracetamol is usually enough as pain relief. As far as the rash is concerned, keep it clean and dry. That will reduce the risk of infection. It's often more comfortable to wear loose-fitting clothing as well.
My friend told me about a vaccine for shingles. I suppose I can't have that now?
Yes, you can. You can still have the vaccine even if you've had shingles. The vaccine will boost your immunity against further shingles attacks. You only have to have the vaccine once. Could you please tell me your age, Mrs. Digby?
My age? Well, doctor, I did say I was getting on a bit. My date of birth is the 10th of October, 1943. I'm 77 this year. Am I too old for the vaccine?
Not at all. The vaccine is given to people at age 70 or 78. It's not usually given to anyone over the age of 80, as it doesn't seem to be effective. You can have it at the same time as your flu jab.
That's a good idea. One last question. How long will the rash last?
You'll probably have the rash for around 4 weeks. Don't worry if your skin is still a bit sensitive even after the rash has gone. It will eventually settle down.
Okay, thank you. I'll make sure that I keep that in mind.